Good morning, sir. Good morning. Yesterday we admitted a 12-years-old boy. He came to ER complaining of fever, cough, shortness of breath and chest pain that started 1 week back. Fever was of low grade, around 38.5, that is relieved by paracetamol. Cough and shortness of breath does not vary from day to night. Yet both improve after expectorating a large rubbery tan-colored phlegm. Rubbery? Did you see it? Yes, sir. He did show it to me yesterday. I never saw something like that before. That is interesting. Okay. Go on, please. Chest pain was all over the chest. Not related to exercise, yet increases with deep breathing and chest palpation. Go on. On chest auscultation, bilateral decrease in air entry is there. In addition to wheezes are noticed, especially at right upper lobe area. Also I heard very strange sounds similar to a flag flapping in the wind. What? Say that again? I said, I heard a sound, as if a flag is flapping in the wind. It was more on the right side of the chest, sir. Does that patient has any past history of cardiac surgery? No, sir. Is he asthmatic? Yes, sir. He is known case of mild asthma. Not on prophylactic medications, yet he does suffer from frequent attacks of asthma exacerbation. Patient was admitted for observation and investigation. His complete blood count and C-reactive protein were negative. Respiratory viral panel is also negative. Influenza PCR is negative? Yes, sir. Okay, go on. Chest X-ray showed right upper lobe opacity, with bilateral fine infiltrations, with bilateral increase in bronchiovascular marking. Did you start any medications? Yes, sir. I started fever and pain control medications. In addition, I started asthma protocol. The only thing that I couldn't understand, sir, is the rubbery texture of the phlegm. I never saw something like that. Also the weird sound on lung auscultation. Never heard it before. Case is clear. You will understand everything in 5 minutes. Bingo.